When Beth Fisher was only 40 years old, she developed degenerative disc disease. Dealing with neck and upper back pain was not something she expected in the prime of her life.
We're a very active family. I am not used to sitting. I'm not used to being tired, and the pain was so exhausting that I usually got up in the morning, went to work, came home, and was resting.
The collapsing discs were causing severe pressure on the nerves in her neck, causing neck pain that radiated down her arm, making it difficult to perform simple tasks. Beth and her husband went looking for answers and visited many physicians.
We did pain medications, we did chiropractic treatments. I got desperate enough where I did the cortisone injections into the back of my neck, which was kind of scary with them putting the needles into the back of my spine. But I was willing to try anything to help with the pain.
But nothing worked, and their search led them to Ohio State Spine Care.
We did a lot of research online and found OSU, who's doing a relatively new procedure where they put artificial discs into your neck, which allows for more mobility, good range of motion, and is much less traumatic to the other parts of your spine above and below where my injury already was.
And while Beth was a bit hesitant about surgery, she felt the procedure was her best option to relieve pain without limiting her mobility.
Immediately woke up from surgery and had no more neck or arm pain. It was really surprising to me how quickly, right away, that the pain was gone. Within 2 or 3 months, I was back to doing everything I had done before I felt terrible. I was on the treadmill, I was doing the elliptical, I was able to go to my daughter's functions and sit in the stands without feeling really uncomfortable.
Beth continues to move forward with life, working, enjoying her family, exercising, and staying healthy.
I could not imagine what my life would be if I had not been able to go to Ohio State and have the surgery that I did. It has made all of the difference in the world for me in terms of being able to continue with my activities, with my job, with doing things with my family.